in New Zealand, where we had Jacinda Ardern, this is a very important story. This comes from the peoplesvoice.tv, and I think it is out of, I'm not sure where it is, thepeoplesvoice.tv. So spread this around. The New Zealand government exempted elites from the deadly COVID jabs. Now, we all figured this out, right? We all figured they're getting placebos, right? Well, actually, we've got the proof. They did what is called in America a FOIA. There they call it an OIA. OIA. Same thing. And they got the documents from these people to show how they were granting vaccine exemptions to the elite. New Zealand's Ministry of Health granted vaccine exemptions to key staff while hypocritically rolling out the world's most draconian vaccine mandates and insisting that the public be vaccinated. The hypocritical vaccine exemptions from the elite, says the People's Voice, were granted by former Prime Minister Jacinda Ardern's government before she stood down and accepted a new role at the World Economic Forum's global, quote, disinformation czar. That's her position now. She's going to attack free speech. Ardern's decision to allow the elite to refuse a vaccine while forcing the vax on normal people was revealed by an Official Information Act, OIA, request dated 2nd of August, 2023. And it asked the question, according to the legislation at the time in 2021, there were operational exemptions available for those who are not getting vaccinated against COVID-19. Your website outlines a process for applying for an operated exemption under Clause 12A. How many requests were received and how many were approved by the Ministry of Health? What an Orwellian title that is, right? Oh, yeah, the Ministry of Love, where they have the police state inquiry. The Ministry of Truth, where they send you the propaganda. And this is New Zealand's Ministry of Health. Well, they replied and they said from the 13th of November 2021 to 26 September 2022. And that's, again, after they approved, give the emergency authorization for these untested vaccines. A total of 478 applications for significant service disruption exemption were received. 103 applications were granted, covering approximately 11,005 workers. Please note, it's not possible to provide the exact number of workers covered by this because it was possible for an organization to submit an application that would cover more than one worker. So they granted 103 applications. They granted about 1/5 of the applications that people asked for. It was just under 500, and they granted 100 of them. But that was 11,000 people, approximately. Now, let's talk about how many people there are in New Zealand and how many government workers. I looked this up. Of course, the population in New Zealand is just over 5 million people. And they have 57,149 government workers. And so these are public employees that were granted this exemption. And for the most part, because, a lot of them are doctors. Of course, they're public employees, government health care. So they're saying that about 20% of them were exempted of the government workers. Now, the other people who you can bet that the people out there actually doing the work did not get exempted. It's the people at the top. Guy Hatchett reports and says, I've made inquiries and found some staff prepared to leak information. One source has told me that 95 consultants in the Dunedin region alone benefited from vaccine exemptions. Another source has pointed to a group of doctors working in Northland who arranged among themselves to remain unvaccinated. That total appears to be hundreds and possibly more. It seems that those granted exemptions were restrained by gag orders. Gag orders. Right? I'm not going to, just between us, you don't have to get this thing. But you're going to help us to push this, right? But you better not tell anybody about this. Yeah, not the mask orders. These are gag orders. Everybody upset about Trump's gag orders? This ought to go global, this story. Let's talk about the gag orders, about the people who were given exemptions and didn't have to get the vaccines, even though they were crafting the policy and administering the vaccines to other people. They didn't have to get it themselves. That's the kind of gag order we ought to be, but everybody's concerned. You mean Trump can't throw personal insults to the people who are opposing him in court? Oh, the First Amendment is over now. Yeah, it died under him, actually. They could not tell anyone that they've been granted exemptions. It was a secretive process that the Ministry of Health was anxious to hide from the public. Yeah, the Orwellian Ministry of Health. In any case, any doctor advising a patient that the mRNA vaccine might be risky faced disciplinary action, and many of them were actually suspended. So medical staff allowed themselves to be manipulated into a position whereby, if they were unvaccinated themselves, they were still required to advise their patients to vaccinate. Widespread hypocrisy. Cynical, criminal hypocrisy. Whatever happened to medical ethics? Whatever happened to first do no harm? Gone, folks. Understand the corporate hospital system, or the government hospital system, as you see in New Zealand and most other countries, is hopelessly corrupt. This process was certainly approved by Dr. Ashley Bloomfield, who himself gained considerable notoriety by refusing vaccine exemptions to those among the public who had already been severely injured by the first shot. He said, okay, I don't care that you were severely injured by the first shot. You survived, get another one. And he got an exemption, or he approved these. So insisting that they continue along with the vaccination schedule. Given Dr. Bloomfield's close work with Jacinda Ardern and Chris Hipkins, it is quite likely that they were both aware of the process and approved it. The opposition leaders were also kept in the loop. So when you look at this video here of Jacinda, and she's never looked better with her horse face covered with a mask. It ought to be required for her, at least. But you look at her getting this jab they put out there for everybody. Do you believe that that's real? You believe that's a placebo? I do. I believe that all of these people like Trump and Biden and Jacinda Ardern, I believe they were all posturing with all this stuff while they cynically poisoned their own people. That's the reality. The criteria for granting exemptions apparently entailed an assessment concerning how vital staff were to the working of the health department. Oh, okay. So, wouldn't you say, because this is the argument that they use for us, well, hospital people, you need to get it first. Because, well, you got to, if you don't get it, you're going to spread it. If you don't get the shot, you're going to spread this deadly virus. So the argument has been that it's necessary for the health people to get it. But instead, they looked at this and they said, well, wait a minute. How vital are our staff? If it's somebody that we think is really important, not necessarily that they're necessary, but they've got good connections. If they're vital staff, this is an admission that they believe that this is very risky, right? If it was necessary, safe, and effective, you would give it to your vital staff first. But they're saying, wait, we'll give them an exemption if we really need them. What's that tell you? Well, it tells you that they deliberately poisoned people. Used people as lab rats, just as, Netanyahu can brag about that to his World Economic Forum masters about how they're using their people for lab rats for Pfizer. And of course, these people did the same thing. How many ways do we need to cut this? You see these people using their people as an experiment. You see other people saying, well, those of us who are important, we're not going to take it. We'll give it to the hoi polloi out there. Senior officials and those holding key surgical positions could actually insist that they remain unvaccinated and continue to be allowed to work. While there were brutal recriminations against anybody who warned the public, brutal recriminations against anybody else who didn't get it. So why did senior medical staff choose to remain unvaccinated? Asks this article. Well, we all know. Because they're liars, they're hypocrites, and they're murderers for hire. They may have been made aware, says this article, of a 2019 paper that was in the Frontiers of Oncology journal, Cancer Journal, that was titled Gene Therapy Leaves a Vicious Cycle. You know, we're seeing that this stuff is all these different effects and how it doesn't stop. And this is what they said in the Journal of Oncology. Gene therapy leaves a vicious cycle. They said, gene therapy has been caught in a vicious cycle for nearly 2 decades, owing to immune response, insertional mutagenesis, viral tropism, off-target activity, unwanted clinical outcomes ranging from illness to death of participants, and from patchy regulations. For 2 decades, we haven't approved any of this stuff because it kills people, it mutates people, it causes cancer, it accelerates cancer, and on and on and on. They knew it. They knew it. And now, what is it? Now, that's the new race. We've got to have mRNA for everything. Got to put mRNA in your food even. Inject it into the animals. Make food, reproduce all of this stuff. Look, this is one of the reasons why Moderna had been around for over a decade. And they'd never had a market that came never had a product that got to market. They existed off of all these fairy tale stories that they would tell people on Wall Street. Hopium. They were selling hopium on Wall Street. And everybody's, oh, look, we got this new drug, and it's done these great trials, and it does this and does that. Wow, that sounds amazing. That's going to be amazing. You can use this mRNA stuff, and it's going to cure this and cure that. And yet, when they would go to the trials, everybody said, well, you know, it's killing participants. We have all these unwanted clinical outcomes and everything. So they never got anything approved until Trump and Operation Warp Speed. Same story as remdesivir. You know, for years, they said it destroys, I think it's your liver. It destroys your body, it destroys your organs, and it doesn't do anything. You tried to sell it with for AIDS. You tried to sell it for Ebola. But then again, you know, with Trump and Fauci, they got it approved for the imaginary virus. So, yeah, for 2 decades, nobody did it. Incredibly, against the evidence, the government in New Zealand, the government in the United States, still encouraging the public to get vaccinated. That's right. 2% of the people will do it, too, in the United States. And then there's this. The 2023 excess death data across different countries. Now, this is very incriminating. This is an excellent article. The people's, let me get it again so I can tell it to you. The People's Voice.tv. Okay, so what they did was they looked at the most highly vaccinated nations and the least vaccinated nations. And they looked at the excess death rate. And so the most highly vaccinated nations, Portugal, Chile, Canada, Iceland, New Zealand, Spain, Australia. The average percentage of the population vaccinated with those nations, 91%. Their excess deaths so far this year, 2023, 12% above the 5-year historical average. 12% of the people killed by that. 91% of the people vaccinated, 12% more than the usual number of deaths. In the least COVID vaccinated nations, the Slovak Republic, Slovenia, Poland, Estonia, Czech Republic, Hungary, Switzerland, the average percentage of the population vaccinated is only 63%. Their rate of excess deaths so far in 2023 is 0%. And they point out in this that the insurance companies, the actuaries, insurance companies make a lot of money. They make a lot of money by predicting across the board how many people are going to die. They've got it down to an exact science. And this is why it was such groundbreaking news when at the beginning of 2022, we were told that big insurance company out of Indiana, One America, I think, if I remember the name correctly, they said, we have seen something you wouldn't expect in hundreds of years. This is more than 3 standard deviations away from the mean, the number of people who died. And it began in the 3rd quarter of 2021, not during the so-called pandemic. It began when they rolled out the vaccines, and then it continued on in the fourth quarter and so forth, when everybody was getting vaccinated. And then he spends, the CEO lies to you. He says, well, we were told that these were not COVID deaths, and yet I know they were. You know they were? You know better than the people who got the data? And he says, and furthermore, I also know that nobody's going to die if they get the vaccine. So these people, I say, died of COVID, and I say it was only the unvaccinated. So we're going to go up on the insurance rates of the unvaccinated. This is why I say this is a public-private partnership to kill us all. And so 0% in those least vaccinated, 63% of the people vaccinated, only 0% excess deaths. And the places where they got 91% of the population vaccinated, 12% excess death, 12% over the usual. Yeah, what does that tell us? It tells us that the father of the jab, Trump, who calls himself the father of the vaccine, is a mass murderer. And he's our most popular politician. Yeah, it's just like going to China and seeing all of these posters of Mao. We'll never get over it. It'll never change. Trump will always be a hero. When he dies, he will have been assassinated by the deep state and the globalists, except he was for them. Mao killed probably 100 million of his own people, unnecessarily, deliberately, for power. You could try to make an excuse and say, well, he just didn't know this, what he was doing with the Great Leap Forward and sending everybody out in the fields who didn't know anything about growing stuff. And no, it was deliberate. And they still worship him. And Trump will still be worshiped with all this stuff. And the Pfizer trial, the unvaccinated control group were all vaccinated after just a couple of months to make sure that nobody saw any long-term effects. But even though they vaccinated them, before they vaccinated people, they saw a huge difference in people who had very severe outcomes or death because of that. This is why they're exposed to fraud. And perhaps we will start to spell fraud with a P in front of it, like we spell Pfizer with a P in front of it. So according to the OECD, there were 1.2 million excess deaths in 2022. To give you a starter figure about what Trump killed, because that's not even counting the hospital death protocols of 2020. And so the take on this is the one thing that I'm concerned about with this article. I say now it's becoming accepted that both COVID and COVID vaccinations began their lives in a biotech lab. It doesn't seem to matter much what proportion of excess deaths are due to COVID and what are due to COVID vaccination. Well, I disagree with that. We must not buy this gain of function lie about that is a tactic that is being used by all the mainstream media. It's being used by these politicians, these cynical, murdering politicians, being used by them as an excuse for the vaccine industry and to target China. The Wu flu, the China flu, the this, that, right? It's to help to generate anger about China. No, we were shot and killed by our own government. And I began the show today with this because I want you to understand as they push us further and further into war, they don't want us to take a side. You understand, these people kill their own people. Netanyahu killed his own people, the guy who's pushing this war. You trust him with any of this stuff? You trust any of these narratives coming out, even about this hospital thing? I don't. Don't trust these people. Don't follow them. Don't fall into their pattern of fear. They had people killing themselves 3 years ago, 2 years ago. And now they want you to do it again. This 4D chess stuff. And it's the alternative media that's pushing it as well. Oh, they're pushing this lab stuff really hard. Really hard. which is a way to excuse these people. Well, this lab thing, it was so dangerous. We had to do something. Yeah, we made some mistakes because we rushed it, but we had to rush it because the lab stuff from China was so dangerous. No, that was a lie. You killed people with your hospital death protocols for something that wasn't dangerous. Told people to go home, come back when you're really sick, and then we'll put you on a ventilator and we'll give you remdesivir. Not going to give you any treatment. We're going to withhold that. We're going to take people's licenses if they give you hydroxychloroquine or ivermectin or any of this stuff. So, again, what are the motivations of these ministries of health and these politicians who do this to us? Well, don't worry. We just need to fight over Trump and over Biden because, they both killed us. But one of them, Trump, is going to save us. The common man. They created Common Core to dumb down our children. They created Common Pass to track and control us. Their Commons Project to make sure the commoners own nothing. And the communist future. They see the common man as simple, unsophisticated, ordinary. But each of us has worth and dignity created in the image of God. That is what we have in common. That is what they want to take away. Their most powerful weapons are isolation, deception, intimidation. They desire to know everything about us while they hide everything from us. It's time to turn that around and expose what they want to hide. Please share the information and links you'll find at thedavidknightshow.com. Thank you for listening. Thank you for sharing. If you can't support us financially, please keep us in your prayers. thedavidknightshow.com.